if you're struggling with pelvic pain, whether that be in the deep pelvic area, in the pelvic floor muscles, into the hip or groin, or into the abdomen, keep watching this video for 3 easy but effective exercises to get that pain less and get you feeling better. I'm Dr. Alex Hill. I'm a board-certified pelvic health and oncology physical therapist. Make sure that you subscribe to my channel for more pelvic health tips and cancer care tips. Before we begin, make sure that you check with your medical provider before you start any new exercise routine. As we do these exercises, you can start with a small range first or a small movement, and then gradually start to increase that movement or increase the intensity of that movement or the stretch. A little discomfort's okay, but you shouldn't have an increase in pain after you do these exercises. So if you do, stop doing these exercises, talk with your medical provider. First exercise we're going to do is cat-cow or cat-camel. So you're going to have your hands directly beneath your shoulders and your knees directly beneath your hips. You're not moving your elbows at all with this exercise, but if this bothers your wrist to be in this position, then you can go up onto your fists and keep your wrists straight. That's going to help decrease any pain or discomfort that you have at your wrists. Otherwise, you can just have your hands flat. And we're going to start by rounding your back, dropping your head, and really kind of tucking your tail underneath you as you breathe in. And then as you breathe out, you're going to arch your back, really bring your bottom up, head up as well. You should feel a stretch in your abdomen. And then you're going to breathe in, round your back, breathe out, arch it, lift up. And you're going to do this for about 10 times. You can certainly do it for more than that. But as you do this movement, make sure that you do it nice and slow. Do it with your breath. And if you feel like you need to start in a smaller range first, that's okay. Just listen to your body and do what feels good. As you continue with this exercise, if you have to start out with a smaller movement and a smaller range, you should find that you're able to get into a deeper range and bigger movement as you start to get more mobile and as those tissues start to get more flexible, we get more blood flow in there, the pain starts to decrease. But we just need to start with small movements first. So again, we're doing this in about sets of 10, but you can certainly start with less to start with, or you can do even more if that feels better for you. When you're doing this, you don't want to lock out your elbows, and you're also not bending them, so you're just keeping them in a comfortable straight position, really rounding and arching your back, not moving your elbows or your knees, and doing it with your breath, and getting into bigger and bigger movements. You can hold it for a little bit longer if that feels good for you. The next exercise we're going to do is tail wags. So we're going to be in the same position. So again, if you need your wrists underneath you with your hands into fists to decrease any wrist discomfort, that's fine. But we're doing the same type of thing where we're not moving our elbows. Those are staying straight. And you're going to bring your hip towards your shoulder and you're going to try to look at that hip. So you're kind of making your body into a C. So go ahead and breathe out as you bring your left side together. Breathe in as you straighten out. Breathe out as you go to the other side. Breathe in as you straighten. So that's one movement. So going to the left, going to the right is one movement. Again, we're going to do that about 10 times, but if you feel like you need to do it more, you can certainly do it more. If you need to start out with less, definitely start out with less. Just listen to your body and what your body needs. And just like with the first exercise, if you need to start in a smaller range first, that's okay. Just start in that smaller range first, and as that movement starts to feel more fluid, it starts to feel better, go ahead and get into a deeper range and really stretch those muscles. As you do this exercise, you should feel some stretches primarily on the side of your trunk, maybe even into your glutes a little bit. And this is a great exercise for starting to dissociate your pelvis from your trunk and getting some more movement in there, starting to decrease some of that pain. And again, don't forget to move with your breath. Definitely no holding your breath. If it's hard for you to coordinate the movement with your breath, that's okay. Just make sure you're breathing and not holding your breath. That's the biggest thing. Just keep moving, keep breathing. Nudge into that discomfort a little bit as you get into those bigger ranges. Now, the last exercise we're going to do, you're going to be on one knee and you're going to have your other leg straight out, and we're going to be doing rock backs. So you're going to be supporting yourself with your hands and you're going to sit back onto that leg that's bent and then come forward. Rock back and then come forward. Rock back and come forward. So you should be feeling a stretch into that upper thigh here. Rock back, come forward. Again, if you need to start with a smaller range, that's okay. Just start in that smaller range with what's comfortable for you and progressively work towards that deeper stretch, really sitting back into that stretch, feeling a deeper stretch into that inner thigh. And make sure again that you're breathing with it. We're not holding our breath with this. You can breathe out as you sit back into it. Breathe in on the way up. Same thing for this exercise, about 10 times, but if you get anywhere from 8 to 12, that's great. And if that feels good and you want to do a little bit more, awesome, go for it. Just make sure that you're not overdoing it with these exercises and just start out with what feels good. See how your body responds to those movements and those stretches. And then we're going to switch sides. So you're going to have that other leg out. Support your hands, and then you're sitting back into that knee that's bent and into that glute. You're feeling that nice big stretch into that inner thigh. We're rocking back and forward. Back and forward. Again, make sure you're breathing as you do this movement. Start in a smaller range first. Feel what feels comfortable for you. Get into that, and then just nudge a little bit into that discomfort, into that stretch. Again, we're working on pelvic pain, so we don't want to just barge through that. We want to just ease our way into more mobility, more movement, and what feels good. Make sure you're breathing with it. Sit back even a little bit more as you do this. And again, you should be feeling that stretch into that upper inner thigh here. Great job with those exercises. I hope that you're able to get some relief with your pelvic pain symptoms. Make sure that you're consistent with doing these exercises to get the best relief and the best outcomes. If you found this video helpful, please like it, make sure you subscribe for more videos on pelvic health, and share this video with somebody who needs it.